Hello friends, microorganisms play a very important role in our day-to-day life. There are beneficial organisms or there are harmful organisms. So microorganisms, they play important role in life, and today we are going to study about one such pathogen, which is Streptococcus pneumoniae. Now, what is Streptococcus pneumoniae? Today we are going to study about the morphology, cultural characteristics, what does this cause and how can you prevent the infections from the Streptococcus pneumoniae. So basically in 1881, the organism was found out as pneumococcus, and it was first isolated simultaneously and independently by the US Army physician George Sternberg and French chemist Louis Pasteur. They are gram-positive bacteria. Now basically when you say bacteria, they are classified according to the gram staining that is found out by Christian Gam. So he classified the organisms and divided the organisms into two categories, that is gram-positive and gram-negative organisms. So basically Streptococcus pneumoniae is a gram-positive bacteria. They are non-sporing and non-motile. So they cannot be mobile, that is non-motile. They have pili for adherents and they are mostly found in pairs. So therefore they are known as diplococci, that means two cells of organisms they are found in together, that is pairs. Also found singly in short chains isolated from the body fluids. They are lancet shaped or bullet shaped and they are capsulated. So capsule is one of the form of pathogenicity and they are alpha hemolytic. They contain more than 500 different surface proteins. So here in this diagram you can see the gram staining where they appear as gram positive. So gram positive basically they take the stain crystalline violet and gram negative they basically take the safranin. Now here in this another diagram you can see they are formed in the pairs, so that is shown that is they are the diplococci in nature. Now what is the habitat? So Streptococcus pneumoniae they are found worldwide and found in primates, livestock and felines. They are part of normal flora of the upper respiratory tract infections in the human. That is why you can say the pneumonia is caused by pneumonia organisms, which is also known as Streptococcus pneumoniae. So they are responsible to cause the pneumonia, and pneumonia basically it is a respiratory tract infections mostly found in throat and nasal passage, and they infect mostly in the children in winter seasons and they are mesophilic. Now what do you mean by mesophilic? So according to the temperature the organisms are classified into three categories: psychrophilic, mesophilic and thermophilic. Now here they are Streptococcus, they are divided into again three categories: alpha hemolytic, beta hemolytic and gamma hemolytic. So basically the Streptococcus is what? They are alpha hemolytic. Why? Because they are partial hemolysis, right? Now hemolysis means what? What do you mean by hemolysis? So that is the lysis of the heme, that is the lysis of the RBCs, right? So that is alpha hemolytic. So on the lysis on the basis of RBCs they are categorized into three, that is beta, alpha and you can see gamma. Gamma here hemolytic there is no hemolysis. Beta, yes, there is a complete hemolysis, that is complete degradation of RBCs. So here you can see how they appear in Diplococcus, and you can see even the organisms have taken the stain crystal violet, so they are also termed as gram positive organisms. What are the disease? So initially I told you that the Streptococcus pneumoniae they causes pneumonia, right? Now what in pneumonia, what are the symptoms? So symptoms they are fever, chills, cough, rapid breathing, difficulty in breathing, and even you have chest pain. Now for the elderly they may include confusion, low alertness and the former listed symptoms to the lesser degree. Pneumococcal meningitis is an infection of the tissue covering the brain and the spinal cord. Now symptoms include stiff neck, fever, headache, confusion and photophobia. Now sepsis, again sepsis is caused by overwhelming response to the infection, and it leads to the tissue damage, organ failure and even death. So other symptoms which are of the Streptococcus pneumoniae, they are the shortness of breath, confusion, there is a elevated heart rate, there is a pain in the chest or discomfort, overperspiration, fever, shivering and feeling cold. Now what are the cultural characteristics? If we talk about the cultural characteristics, so this organism can basically be grown on the artificial media in a laboratory. So what are the basic media used for the growth of the Streptococcus pneumoniae? So they are blood agar, chocolate agar. And what is the incubation time? So these organisms can be strict on these artificial medias at 37 degrees Celsius and incubated in an incubator for the further growth. Now after 24 hours, how do you find the colony characteristics? So, but obviously as we discussed earlier, there are colonies, that is the alpha hemolytic colonies, that is partial hemolysis will be found of the RBCs, dome shaped initially, and they acquire specific shape, and that gives that Draughtsman appearance. Now what do you mean by Draughtsman appearance? We'll see this, and this is due to the autolysins by the streptococci, which causes lysine of the older cells in the center. So this is basically the Draughtsman colonies. They appear in the blood agar plate and they're round, translucent and small. Now you can see these colonies, they appear as carom boards, coins. So that is why they are known as Draughtsman colonies. So they have a specific structure. As you see that when we play a carom board, we have those coins which are white and black, and there is a queen pink color. So you can see the it resembles to that coin of the carom board. So that is why these are also known as Draughtsman colonies. So this is again one of the picture, Draughtsman or carom colony appearance. So how do they appear? This is on the blood agar plate. Yes, so clinical features, of course, they are abrupt onset. You will have fever, shaking chill, productive cough, then chest pain and hypoxia. You have dyspepsia. All these are the clinical features when you get the infection from the Streptococcus pneumoniae. It is also known as pneumococcal pneumonia. Basically, we have vaccines. So how is the treatment? There are two types of pneumococcal vaccines that can be prevented. So that is the pneumococcal conjugate vaccine and pneumococcal polysaccharide vaccine. These two vaccines, they provide protection against the most common types of Streptococcus pneumoniae. So but obvious vaccines, they are very much available in the market, and then they are prevented, these vaccines, they can prevent the disease or the infection from the Streptococcus pneumoniae. So pneumococcal conjugate vaccine is recommended for all the children less than 24 months and all for the children between the 24 to 59 months of age who are risk of disease. And for adults, you have the pneumococcal polysaccharide vaccines. Of course, these adults who are older than 65 years of age and persons who are 2 years of age and older and at high risk of disease, that is sickle cell disease, HIV infections and other conditions which weakens the immune system. So this is the treatment, that is the even the pneumococcal, because it is a Streptococcus pneumoniae as a bacteria. So antibiotics are available. What do you mean by antibiotics? Yes, these are the products for the biases or against the organisms or the bacteria, which are also known as antibiotics, and they are produced by many pharmaceutical companies. They have increasingly problem of Streptococcus pneumoniae bacteria developing drug resistance due to the overuse and misuse of antibiotics. So thank you. As we have studied today the Streptococcus pneumoniae, these are the special characteristics of Streptococcus pneumoniae. Thank you.